Hi, this is Dr. Reynaldo ROJoson, Director of the ROJoson PEP Talk. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP Talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My PEC talk today is entitled Fundamentals and Generalities in the Development of Breast Cancer. This is part of the cancer course. The empowerment objective is for the lay people to have an understanding of the fundamentals and generalities in the development of breast cancer as a health disorder or medical disease. Some definition of terms in the title and the limitation of coverage of my talk. Fundamentals means simplest essential facts and theories which can serve as a basis for foundation and support for advanced information. Generalities, general statements of information, not covering specifics and not too detailed. Development of breast cancer, meaning appearance and growth of breast cancer. The contents of this talk will be the following. What is breast cancer? How common is breast cancer? What are the different types of breast cancer? What are the possible and theorized causes of breast cancer? Can breast cancer be prevented? Who are at higher risk of developing breast cancer? What are the behaviors of breast cancers? How does breast cancer kill a patient? And is breast cancer curable? Let's start with what is a breast cancer. Breast cancer is a medical disease when some of the breast cells grow uncontrollably with a potential to invade the adjacent body tissues or organs and to spread to distant tissues or organs. The breast cancer presents as a solid tumor and not as a liquid tumor like blood cancer. It is also known as breast malignancy or malignant tumor of the breast to differentiate it from a benign tumor of the breast which does not invade and spread. How common is breast cancer? Breast cancer is the most common cancer in the world and in the Philippines, in both sexes, male and females. It is more common in females than in males, at the ratio of 100:1. It is more common in the older than younger females, usually about 40 years old and older. What are the different types of breast cancer? Not all breast cancers are the same. It is important to know the specific type as this affects decisions on treatment and prognosis. There are so many different ways of describing the types of cancer. There may be more than 20 types depending on how the description is done. One classification is based primarily on the origin in the specific parts of the breast, such as lobules, where the milk is produced, ducts, which carry breast milk from the lobules to the nipple, okay. Ducts, lobules, connective tissues like blood vessels, fat, muscles in the breast. Okay. So those originating from the lobules and the ducts are usually called adenocarcinoma. And those originating from the connective tissues are usually called sarcomas. Another classification is on the unique appearance of the cancer cells. Examples would be tubular cancer, mucinous medullary papillary. Another method of classifying on the specific cells of origin. So those coming from the lining of the blood and lymph vessels are usually called angiosarcoma, and those arising from the stroma are malignant phylloides tumor, and then those from the fat, liposarcoma. Special types of breast cancer: Paget's disease of the nipple, which usually affect the skin of the nipple and the areola, and inflammatory breast carcinoma, which is usually caused by obstructive cancer cells in the skin's lymph vessels. Another way of classifying breast cancer, based on whether there is already invasion or not. If there is still no invasion, still within the cell, it is called non-invasive adenocarcinoma or carcinoma in situ. If there is invasion already, it's outside the cell, then it's called invasive adenocarcinoma. Based on whether the cancer cells can be fueled by hormones, okay. Examples of hormones would be the estrogen receptors and then the progesterone receptors. Okay. So either estrogen receptor positive or negative, or progesterone receptors positive or negative. Another way of classifying breast cancer, based on the genetic makeup of the cancer cells, HER2 gene, other tumor markers. Then based on the grouping of information on the cancer cells using the receptor assay, the hormonal assay, and the HER2 gene. Okay. So one classification of breast cancer will be in terms of, it will be ERA, estrogen receptor assay positive, progesterone receptor assay positive, and HER2 negative, HER2 negative, ERA positive, ERA negative, HER2 negative, ERA negative, ERA negative, HER2 positive, and then the so-called triple negative, ERA, PRA, and HER2 negative. Let's now go to what are the possible and theorized causes of breast cancer. Unfortunately, up to now, most of the time, meaning 90 to 95%, nobody knows the exact cause of breast cancer developing in a patient, as most of the time, the cause is multifactorial. It's only in 5 to 10% of breast cancers are due to inherited gene mutations from parents. So 90 to 95% are sporadic, and 5 to 10% are due to hereditary gene or cancer. All diseases, including breast cancers, have underlying, antecedent, and immediate causes. All diseases have predisposing, precipitating, and perpetuating factors. However, it is difficult to pinpoint the exact cause as a single cause of that, as oftentimes the cause is usually multifactorial. At best, we can only theorize the possible causes and factors. For a patient with breast cancer, an example of in the analysis or theorized causation for the development of cancer could be as follows. Genetic predisposition could be the underlying cause. Long-term unhealthy lifestyle could be the antecedent cause or precipitating and perpetuating factor. And gene mutation is the immediate cause. Another example will be genetic predisposition could be an underlying cause. Excessive exposure to radiation could be the antecedent cause or precipitating or perpetuating factor, and gene mutation is the immediate cause. Still another example of analysis, not genetic predisposition this time, but the underlying cause may be from chemicals, which now also becomes the antecedent cause or precipitating and perpetuating factor. And then lastly, gene mutation as the immediate cause. At the present stage of knowledge, for the sporadic cases, not the inherited gene mutations from parents, it seems that the last ultimate or approximate or immediate cause of cancer is changes or mutations to the DNA within the cells, which contain the gene. Okay? So thus one can say that breast cancer is a genetic disease. That is, it is caused by changes to the gene that control the way our cells function, especially how they grow and divide. The three most common theorized ways by which a gene can instruct a healthy cell to form a cancer are the following: allow rapid growth. A gene mutation can tell a cell to grow and divide more rapidly. This creates many new cells that all have the same mutation. Fail to stop uncontrolled cell growth. Normal cells know when to stop growing so that we just have the right number of each type of cells. Cancer cells lose the controls that tell them when to stop growing. A mutation in the tumor suppressor gene allows the cancer cells to continue growing and accumulating. Makes mistake when repairing DNA errors. DNA repair genes look for errors in the cell's DNA and make correction. That's the usual way. But if there is a mutation in the DNA repair gene, okay, the errors will not be corrected, so leading cells to become cancerous. What causes gene mutations? What are the underlying antecedent immediate causes? What are the predisposing, precipitating, and perpetuating factors for gene mutations? Gene mutations can occur for several reasons. For instance, gene mutations you're born with. Okay, you may be born with gene mutation which you inherited from your parents, but this type of mutation accounts only for a small percentage of cancers. So this could be the underlying and predisposing cause for the cancer. Gene mutations that occur after birth. Most gene mutations occur after you're born and are not inherited. A number of forces can cause gene mutations after birth, such as smoking, radiation, viruses, cancer-causing chemicals, carcinogens, obesity, hormones, chronic inflammation, and lack of exercise. So these are the antecedent, precipitating, and perpetuating causes. So the gene mutations you're born with and those you acquired throughout your life usually work together to cause cancer. Can breast cancer be prevented? Yes, but not all. Not 100% preventable. Breast cancers develop through multiple factors such as gene predisposition, environmental factors including lifestyle, and aging that is difficult to identify a sure-shot specific strategy of prevention because it is multifactorial. There are some things that can increase the risk of cancer that we cannot change. This includes things like damaged DNA inherited from a parent, family history, and getting older. So this is an infographic on illustrating age as risk factors in DNA change, leading to gene mutation and then cancer development. Usually there are more mutations in older people. Though managing certain controllable risk factors such as diet, physical activity, and other lifestyle choices can lower your chances of developing breast cancer, there is no guarantee. So best effort. So who are at higher risk for developing breast cancer? The exact specific cause of breast cancer developing in a particular patient is difficult to pinpoint. For a preventive program against breast cancer, know the risk factors, know the controllable ones, and then control and mitigate them. Risk factors at present affect your chances of getting a breast cancer, but Remember, having a risk factor does not always mean that you are guaranteed to get it. Again, to emphasize, though managing certain controllable risk factors such as diet, physical activity, and other lifestyle choices can lower your chances of developing breast cancer, there is no guarantee. So these are the uncontrollable risk factors: female, aging, family history of breast cancer, history of breast cancer on one breast, inherited breast cancer gene from the parents. The controllable risk factors are the following: being overweight and obese, lacking adequate amount of exercise, drinking alcohol excessively, using hormonal replacement therapy for those who are menopausal, and then smoking tobacco or exposing to tobacco smoke, and exposing to excessive radiation, particularly to the chest or to the breast area. So controllable risk factors, which the cancer prevention and mitigation tips on these controllable risk factors: maintain a healthy weight, have adequate amount of exercise, drink alcohol in moderation, limit the use of hormonal replacement therapy, avoid exposure to tobacco smoke, avoid excessive radiation exposure, eat healthy diet, more of plant-based diet, and then be in touch with reliable medical information on breast cancer risk and prevention. What are the behaviors of breast cancers? Once a breast cancer develops, it has the potential to grow and invade or infiltrate adjacent organs and tissues, and also the potential to spread to distant sites in the body. The rate of growth and spread of the cancer is dependent primarily on the behavior of the mutated gene, and secondarily on the presence of promoting factors in the person's body, like medications, hormonal levels, and in the environment, like cancer-causing chemicals. A breast cancer that has spread to another place in the body is called metastatic cancer. The process by which cancer cells spread to other parts of the body is called metastasis. A metastatic cancer has the same name and the same type of cancer cells as the original or primary cancer. For example, breast cancer that forms a metastatic tumor in the lungs is metastatic breast cancer and not lung cancer. The most common regional site of spread of breast cancer is the armpit lymph node. And the more common sites of spread, distant sites, faraway sites of spread of breast cancers are the bone, lungs, brain, and liver. How does a breast cancer kill a patient? Two ways: direct causes of death. Okay. So the breast cancer can directly kill a patient when it invades, spreads, or metastasizes to the essential organs like the lungs, bone, liver, and brain, and stop them from functioning properly. The indirect cause or secondary cause of death from breast cancer, okay, through complications during surgery, complications from other forms of treatment such as chemotherapy, infection due to compromised immune system, and malnutrition. There are two leading causes of death for those with breast cancer. These are the venous thrombosis and pulmonary embolism. Both of these conditions come from blood clots. They may end up getting stuck in another part of the body, meaning the clots like your brain and lungs. When the blood clots gets lodged in one of these areas, brain or lungs, blood flow gets cut off and the result can be deadly. Is breast cancer curable? Before I answer this question, let's have a definition of medical cure. The conventional definition of medical cure is that it's a condition that's completely gone and will never come back. For example, if you have appendicitis, the doctors remove your appendix, you have been cured. If you have a gallbladder stones, the doctors remove your gallbladder with stones, you have been cured of the problem. For breast cancer, there are patients who, after treatment, do not have their chances or their cancers coming back 10, 15 years, or even longer. Strictly speaking, they can be considered cured already. However, doctors do not want to categorically use the word cure for them. They use the word or the phrase in remission. Doctors can talk of curative goal at the time of treatment when eradicating the cancers entirely can be done with no effective treatment. At this time, they will just hope that the cancers will not recur. The end effect of the curative treatment can be cured if no cancer recurs after so many years. However, as I said, doctors will never say or guarantee cure to any cancer patient after any type of treatment. Why no doctors would guarantee cure? There are several reasons for this. One, doctors don't know everything yet about breast cancer as a disease. The best information or knowledge so far is that the immediate cause is the gene mutation. Okay, so there are several theories, as I mentioned earlier. The exact mechanism is not yet definitely known. That's why even the targeted cancer therapy working on the molecular or gene level are not yet 100% successful. The second reason is that the usual cancer treatment modalities like surgery, chemotherapy, and radiotherapy are strictly not treating the primary cause of the cancer because we don't know exactly where the cause is. They just extirpate, kill with drugs, and burn the cancer. If the primary cause is still around, there's always the possibility of recurrence after treatment. The third reason is no two cancers are the same. Each individual cancer possesses different biological characteristics, even cancers of the same type and same extent. Some are slow growing and some are fast growing. Usually the biologic behavior of the cancer is not known at the time of treatment. It's difficult to know. Thus, only time will tell the outcome of the treatment. And lastly, after treatment, some cancer cells may remain somewhere in the body unnoticed, and patients are asymptomatic for a long time, even as long as 10 years, 20 years, but can eventually grow, divide, invade, and spread to distant areas and become a nuisance. Okay. This time it's called a recurrence. Okay. So complete remission means that tests, physical exams, and scans show that all signs of your cancer are gone. Some doctors also refer to complete remission or no evidence of disease or no evidence of recurrence, NER. Okay? But mind you, complete remission does not mean cure. So if there is a recurrence, okay, after so many years of remission, okay, some cancer cells can remain unnoticed in the body for years after treatment. If a cancer returns after it has been in remission, it is called a recurrence. A cancer can recur in the same place where it was originally diagnosed, or it can recur in the different parts of the body. So up to now, strictly speaking, there is no true cure for cancer, meaning there's no guarantee it will not recur. Physicians do not talk of cure. They use the word remission if there are no signs of recurrence. But the physicians, together with the patients, always hope for a cure, especially for those cancers which are recognized, diagnosed, and treated early with a known track record of slow growth in behavior. To boost the morale of breast cancer patients, though, one may say that the patient is cured already if there is no recurrence after 10 years or more. But the caveat is there is always an exception to this. Long remission is usually seen in patients diagnosed and treated early. So the advice is to have the breast cancer diagnosed early and treated early also. So summary, conclusion, and takeaway. I have discussed all of these items. What is breast cancer? How common is breast cancer? What are the different types? What are the possible and theorized causes? Can breast cancer be prevented? Who are at higher risk? What are the behaviors? How does breast cancer kill a patient? And is breast cancer curable? Takeaway in relation to patient empowerment: be always in touch with the reliable medical information on fundamentals and generalities in breast cancer development. As we know, knowledge is power. It gives power. Use the 4Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to prevent breast cancer. And in case it is not prevented, to gain greater control over decisions in the management. With this, I end my pep talk, fundamentals and generalities in breast cancer development. I hope I have empowered you to have a better understanding of the fundamentals and generalities in the development of breast cancer as a health disorder or medical disease. Thank you and good day. Mabuhay kayong lahat.